Welcome.
Assalamu alaikum.
Wa alaikum assalam. How are you, mister?
Thank you.
Have a seat, please.
Thank you.
Welcome. Hello, mister.
This is my file, doctor?
Good. You are in our hospital.
Yes.
Good. So, just what's your name, please?
I'm Rabi. It's
Oh, fine. Good. So the name is Bara Abed. Mr. Bara, I'm your general practitioner, Ahmad alshareef.
Nice to meet you, Doctor.
Me too, Mr. Bara. And I'm here to examine you and to work together to solve your problems, inshallah. So, I think all of your personal information is written in your file, but let us reach it. What about your age, Mr. Bara? How old are you?
I'm 40 years old.
40 years old. Good. And where are you from?
I'm from Syria,
From Syria.
but I live here previously.
And you also work here as an officer, right?
Yes, exactly.
Good. Are you single or married, Mr. Bara?
I'm married.
That's good. So, Mr. Bara, as what's written here in your file, I see you are hospitalized in our hospital for 2 days. And the reason was you had a chest pain, right?
Exactly.
And the doctors the findings was just an increment in blood pressure. But the good things, everything else is normal.
Yes, alhamdulillah.
Alhamdulillah, even your heart vessels, and that's important for us. So, Mr. Bara, how do you feel after 2 days hospitalization or hospital?
Alhamdulillah, I'm comfortable. Everything is okay. Hospital is very good. The service here is very good.
Alhamdulillah, alhamdulillah. And how can I help you, Dr. Bara?
Just
Mr. Bara, sorry.
as you read here, I have high blood pressure. I have chest pain. I supposed to remeasure my blood pressure again
Oh,
by you. Yes.
good. So I will examine you. I'll just start by asking you some questions about your chest pain. Mr. Bara, if I give you a scale from 1 to 10, 10 is the worst. How much harmful do you feel chest pain was?
Around 3 to 4, not more than 4.
And did you suffer from chest pain before that?
Before this episode, no.
By the way, when did your chest pain start? Just before these 2 days, or?
No, yes,
how long do you-
just before these 2 days. Yes.
So directly you come to our hospital. So, Mr. Bara, are you allergic from anything?
No,
So you are not sensitive for anything.
alhamdulillah.
And do you do exercise, Mr. Bara?
I actually not that much.
Oh, unfortunately.
From year to year.
And what about drugs? Did you take any drug for
No.
this situation, for chest pain? No.
Not at all.
So you are not doing exercise that much. That's bad. Mr. Bara, I'll ask you some questions about or some personal questions. So can
Go ahead.
you don't mind. Are you a smoker, Mr. Bara?
Yes, actually I smoke a lot.
Smoker. So you are a heavy smoker.
More than 1 pack a day. Yes, I'm a heavy smoker. Yes.
Unfortunately. And did you suffer from any chronic diseases or anything related to your lung and chest?
No.
No. What about your relatives?
No.
Good.
I didn't remember one of my relatives. I've such this disease now.
Good. So after these questions, I need just to examine your lung, and actually I want to examine your vessels, the circulatory system. Your vessels. So can I, Mr. Brown?
Yes. No.
Can we go to the examination? So I'll just stand here, please. So I'll start by examining your lung and then your vessels. After that, we'll do laboratory tests, and then we'll see the results. Yes, Mr. Bara, so can we start?
Yes.
So, Mr. Bara, after I did the examination, physical examination for your lung and circulatory system, and after we did the laboratory
Doctor,
tests,
sorry for interrupting you. I remember that one of my uncles have high blood pressure, and his son died of myocardial infarction last year. Yes.
well, that's important actually.
Mm.
So your relatives has or had
Yes, my uncle is.
Good. So after this information and after the examination that we did and the blood test that we did in the laboratory, actually, Mr. Bara, you are safe. You are normal. Just you have an increment in blood pressure and from the first degree. So you have, as we called it,
It's not that dangerous.
yeah, alhamdulillah, alhamdulillah.
Oh,
As we called it, first degree hypertension. I think the cause is, Mr. Bara, just because you are a heavy smoker and your lack of exercise.
Mm.
So just the treatment will be to stop smoking. I hope that from you, Mr. Bara, and to start doing exercise. I hope you make a table for if the exercise that makes stress for you, just make a table and each day do an exercise more and more.
Inshallah, I will try.
And
It's
please-
difficult, but
I hope that.
Inshallah.
I hope you will be strong and stop smoking and do exercise, inshallah. Even your relatives has, as you said, this or this disease before, so maybe it will be transported by heredity, so it's normal. Do not worry, Mr. Bara, everything will be good. I'll give you
Is
this.
there any medication?
Yeah, I'll give you these medications
Uh-huh.
to just relieve you from these symptoms.
Yes.
But really, believe me, the most important treatment is to stop smoking and do exercise.
Change my life.
I hope that, yes, change your lifestyle, Mr. Bara. I hope from you also to visit me after 2 weeks to just recheck and re-examine your blood pressure and to re-examine you.
Where can I find you?
In the same clinic, in the same
And when?
office. Anytime you want.
Uh-huh.
I'll give you my number.
Yes.
If you had any complication, during this period, just call me,
Uh-huh.
and you are welcome anytime, Mr. Bara.
Thank you, Doctor.
So
I
this
appreciate
is my
your
number,
cooperation.
and thank you, Mr. Bara. This is the medications. Here is the medication and my number. Please stop smoking and start doing exercise.
Inshallah.
Thank you, Mr. Bara. Thank you for coming.